Which hormone is produced by the adrenal cortex? A. Adrenaline. B. Cortisol. C. Melatonin. D. Thyroxine. These hormones are chemical messengers that travel through the bloodstream to target organs and tissues, influencing processes such as growth, metabolism, and mood. The endocrine system is a network of glands that produce and release hormones to regulate various bodily functions. One. Which gland is responsible for regulating the body's metabolism? A. Thyroid gland. B. Adrenal gland. C. Pituitary gland. D. Pancreas. Rationale. The thyroid gland secretes hormones such as thyroxine, T4, and triiodothyronine, T3, which regulate metabolism. 2. What hormone does the pancreas secrete to lower blood sugar levels? A. Insulin. B. Glucagon. C. Cortisol. D. Epinephrine. Rationale. Insulin is produced by beta cells in the pancreas and helps lower blood sugar levels by promoting glucose uptake by cells. 3. Which hormone is produced by the adrenal cortex? A. Adrenaline. B. Cortisol. C. Melatonin. D. Thyroxine. Rationale. Cortisol, also known as the stress hormone, is produced by the adrenal cortex and helps regulate metabolism and stress response. 4. Which of the following hormones is not produced by the anterior pituitary gland? A. Growth hormone, GH. B. Adrenocorticotropic hormone, ACTH. C. Thyroid stimulating hormone, TSH. D. Antidiuretic hormone, ADH. Rationale. Antidiuretic hormone, ADH, is produced by the posterior pituitary gland, not the anterior pituitary gland. 5. What is the primary function of the parathyroid glands? A. Regulation of blood sugar levels. B. Regulation of calcium levels. C. Production of adrenaline. D. Regulation of body temperature. Rationale. The parathyroid glands secrete parathyroid hormone, PTH, which helps regulate calcium levels in the blood. 6. Which of the following conditions is characterized by excessive thirst and urination due to inadequate production of antidiuretic hormone, ADH? A. Diabetes mellitus. B. Diabetes insipidus. C. Cushing's syndrome. D. Addison's disease. Rationale. Diabetes insipidus results from inadequate production or response to ADH, leading to excessive urination and thirst. 7. What is the primary treatment for hyperthyroidism caused by Graves' disease? A. Thyroidectomy. B. Radioactive iodine therapy. C. Corticosteroid therapy. D. Beta blocker medication. Rationale. Radioactive iodine therapy is often used to destroy thyroid tissue and reduce hormone production in hyperthyroidism. 8. Which of the following is a characteristic symptom of Addison's disease? A. Weight gain. B. Hyperpigmentation of the skin. C. Hypertension. D. Hyperglycemia. Rationale. Addison's disease is characterized by adrenal insufficiency and can lead to hyperpigmentation of the skin, especially in areas of increased friction or pressure. 9. What is the primary treatment for hypoparathyroidism? A. Thyroid hormone replacement therapy. B. Calcium and vitamin D supplements. C. Corticosteroid therapy. D. Insulin therapy. Rationale. Hypoparathyroidism results in low calcium levels, and treatment typically involves calcium and vitamin D supplementation. 10. Which hormone replacement therapy is used to treat hypothyroidism? A. Glucocorticoids. B. Insulin. C. Levothyroxine. D. Human growth hormone. Rationale. Levothyroxine is a synthetic form of thyroxine, T4, and is commonly used to treat hypothyroidism by replacing deficient thyroid hormone levels. 11. Which condition results from excessive production of cortisol, often due to prolonged use of corticosteroid medications? A. Addison's disease. B. Cushing's syndrome. C. Graves' disease. D. Hashimoto's thyroiditis. Rationale. Cushing's syndrome is characterized by excessive cortisol production, leading to symptoms such as weight gain, central obesity, and thinning of the skin. 12. What is the primary treatment for type 1 diabetes mellitus? A. Insulin therapy. B. Oral hypoglycemic agents. C. Thyroid hormone replacement therapy. D. Weight loss surgery. Rationale. Type 1 diabetes mellitus results from autoimmune destruction of insulin-producing beta cells in the pancreas and requires lifelong insulin therapy. 13. Which hormone is deficient in individuals with growth hormone deficiency? A. Insulin. B. Thyroxine. C. Growth hormone, GH. D. Cortisol. Rationale. Growth hormone deficiency results in decreased production of growth hormone, leading to growth retardation and other symptoms. 14. What is the primary treatment for hyperparathyroidism caused by a parathyroid adenoma? A. Surgical removal of the adenoma. B. Radioactive iodine therapy. C. Calcium and vitamin D supplementation. D. Corticosteroid therapy. Rationale. Hyperparathyroidism caused by a parathyroid adenoma is often treated with surgical removal of the adenoma to restore normal parathyroid hormone levels. 15. Which hormone is responsible for stimulating milk production in the mammary glands? A. Oxytocin. B. Prolactin. C. Insulin. D. Thyroxine. Rationale. Prolactin is produced by the anterior pituitary gland and stimulates milk production in the mammary glands during lactation. 16. Which hormone regulates blood calcium levels by stimulating calcium reabsorption in the kidneys and activation of vitamin D? A. Parathyroid hormone, PTH. B. Calcitonin. C. Aldosterone. D. Growth hormone, GH. Rationale. Parathyroid hormone, PTH, is secreted by the parathyroid glands and helps regulate blood calcium levels by increasing calcium reabsorption in the kidneys and activating vitamin D. 17. What is the primary function of insulin in the body? A. To increase blood sugar levels. B. To decrease blood sugar levels. C. To regulate blood pressure. D. To regulate body temperature. Rationale. Insulin is a hormone produced by the pancreas that helps lower blood sugar levels by promoting the uptake of glucose by cells for energy. 18. Which hormone is responsible for stimulating ovulation in females and testosterone production in males? A. Follicle-stimulating hormone, FSH. B. Luteinizing hormone, LH. C. Estrogen. D. Progesterone. Rationale. Luteinizing hormone, LH, stimulates ovulation in females and testosterone production in males. 19. Which gland is responsible for producing melatonin, a hormone that regulates sleep-wake cycles? A. Pineal gland. B. Thyroid gland. C. Thymus gland. D. Hypothalamus. Rationale. The pineal gland produces melatonin, which helps regulate the body's sleep-wake cycles. 20. Which hormone is responsible for stimulating milk ejection, letdown, during breastfeeding? A. Oxytocin. B. Prolactin. C. Estrogen. D. Progesterone. Rationale. Oxytocin is produced by the hypothalamus and released by the posterior pituitary gland, stimulating milk ejection during breastfeeding.